So another good exercise to do early on after knee surgery are calf raises. Not only will calf raises help improve the activation of your calf muscle and wake them back up, but it'll also help get some swelling out of your lower leg. So any swelling that you had below your knee, the way that your body gets rid of that is through using its muscles to pump it out of there. And calf raises are a good way to get those muscles firing and help get any of the fluid out of the lower leg. By doing that, you'll also help decrease your chances of having a blood clot, which is something that you don't want to happen. So to do calf raises, you might be a little tentative at first. That's totally fine. That's why I tell people to initially do them in front of a table or by a countertop. Okay, and when you do them, just put your hands on the table or countertop for support. Okay? Don't lean on it and push off with your hands. Okay? So just have them there for support. Stand about shoulder width apart with your feet, and then just go up and down on the balls of your feet. You might be 70% on the leg that didn't have surgery and 30% on the leg that did have surgery, and that's totally fine. Okay, that's your starting point. It should get better and better each day. You should get to the point where you're, instead of 70-30, now you're 50-50, and then you work your way towards getting onto just one leg. As you get better with it, going to one leg might be too much for you to handle. So what I have people do is just put their other leg back a little bit and stand on your toes, kind of like a kickstand, and then just go up and down. And then once you're okay with that, you can just go onto the one leg. Usually I have people do 3 sets of 15, 2 or 3 times a day. Again, there's really no limit on these because they're such a basic, low-level exercise. But give it a shot and see how it goes.